This video will demonstrate how to clinically assess ankle and subtalar joint mobility and ankle overall strength. In order to do this, I will assess active movements, passive movements and resisted movements. Active movements refer to movements that an individual can perform independently, using their own muscles without assistance. These movements are to evaluate the range of motion, strength, coordination and functionality of various joints and muscles in the body. Passive movements refer to movements of a person's body parts that are performed by an external force. Passive movements are often used to assess joint mobility, flexibility, and to detect any restrictions, stiffness or abnormalities in the joints. Resisted movements refer to movements in which the patient actively contracts their muscles against the resistance provided by an external force. These movements are used to evaluate muscle strength, power and function by applying resistance to specific movements. It is possible to assess the strength of an individual muscle group and identify any weakness or imbalance that may be present. The ankle joint consists of two movements, flexion and extension, while the subtalar joint consists of two movements which are internal and external rotation. This video demonstrates active movements at the ankle and subtalar joint. Firstly in the video, dorsiflexion is seen, followed by plantar flexion. Then, of the subtalar joint, eversion is seen, followed by inversion. This demonstrates passive movements at the ankle and subtalar joint. Firstly in the video, dorsiflexion is seen, followed by plantar flexion. Then, inversion of the subtalar joint, followed by eversion. This video demonstrates resisted movements. Firstly in the video, I begin by doing plantar flexion. This begins by using an isotonic movement where the ankle joint is taken through its entire range, followed by 3 isometric holds throughout the movement, which is one at the bottom of the range, then mid-range, followed by the top of the range. Then I move on to dorsiflexion, which is similar to plantar flexion, where I begin with an isotonic movement where the joint is taken through full range, followed by 3 isometric holds where the muscle length doesn't change and is under resistance. The 3 holds are done at the bottom, then middle, and finally the top of the range. Next is the resisted movements at the subtalar joint. Firstly, I begin with eversion. Eversion begins in the same way, where the joint is taken through full range with an isotonic movement, but only 1 isometric hold is done due to there not be as much range of movement in the subtalar joint as the ankle joint. Next, and finally, inversion, which is similar to eversion, where I begin with an isotonic movement followed by 1 isometric hold. This is an example of the functional test used at the ankle and subtalar joint. This test is used to determine flexibility and any differences in range and imbalances between the injured side compared to the healthy side. It can be a good indicator to the amount of pain the patient is in. During the test, the individual stands facing the wall with their feet flat on the ground and toes a few inches away from the wall. Keeping the heel on the ground, they then attempt to touch their knee to the wall without lifting the heel off the ground or allowing the knee to collapse inwards. The distance between the toes of the wall provides a measure of the ankle dorsiflexion range of motion, with greater distance indicating limited flexibility.